Why I chose to become an APRN by Asuquo-Ating. As a registered nurse, I have seen patients admitted for preventable diseases that could have been avoided with proper patient education. I want to become an APRN so that I can collaborate with patients and educate them on disease prevention and find ways to prevent any pre-existing diseases from worsening. An APRN is trained to diagnose, assess, and create a treatment plan for patients in a variety of healthcare settings, making the role similar to that of a physician. But APRNs focus on providing holistic patient-centered care, which consists of examining the person physically, psychologically, and socially in the management and prevention of disease. Almost 50 million Americans gained access to health insurance. The adult primary care workload in the U.S. is expected to increase by 29% by 2025. This projection is expected to lead to a shortage of 35,000 to 44,000 primary care providers. This shortage can be reduced by utilizing APRNs. I want to be part of the APRN community because it gives me the ability to specialize within my area of practice. It allows me to focus on holistic centered care while collaborating with patients, and it gives me the ability to see how my interventions have improved the patient's health. As an APRN, I value my ability to provide holistic, patient-centered care to underserved populations, and my ability to help reduce the health disparities that these populations face. I would like the public to know that variation of state regulations on scope of practice is a hindrance to APRN practice. This can prevent APRNs from practicing to their full capabilities and can prevent communities from gaining access to more providers. In many states, APRNs are even required to practice under the supervision of or collaborate with a physician. Removing practice barriers is a critical step in improving practice and access to care. To remove practice barriers, health policy must be changed. Fight for your APRNs by writing state legislators today. I chose the Adult Gerontology Primary Care Nurse Practitioner program. Adult gerontology primary care nurse practitioners care for patients aged 13 through geriatrics and focus on patient education, monitoring chronic conditions, managing medications, and coordinating care. Adult primary nurse practitioners work in outpatient settings that provide internal medicine services or specialized support for chronic conditions like heart disease and COPD. They work in community clinics, palliative care facilities, and private practices. Adult primary nurse practitioners will be increasingly needed as the age of the U.S. population continues to rise. Thanks for watching.